Chronic hepatitis and familial liver diseases in dogs. So liver fibrosis is reversible and there's no regenerative nodules. And liver cirrhosis is irreversible with regenerative nodules. In dogs with liver cirrhosis, the liver gets smaller. In cats with liver cirrhosis, the liver gets bigger. The signs of chronic liver disease are ascites, HE, polyuria, polydipsia, icterus, and coagulopathies. In the lab results, we can expect to see an increase of ALT and ALP and a decrease of albumin. For chronic hepatitis, we need to discuss the definition, the pathophysiology, and the background. The background can be genetics, infectious, and drugs. Then discuss copper's role in hepatitis. In copper chronic hepatitis, it can have a primary form and a secondary form. The primary form of copper hepatitis, which is familial, exists in the Bedlington Terrier as an autosomal disease, and it appears in Dobermans when you give them steroids. The secondary form of copper hepatitis is due to another cause. Copper storage disease in Bedlington Terriers is a primary form of copper hepatitis. In patients that are homozytes, the copper is present in the lysosomes, and in patients that are heterozytes, there's a transient copper increase. The methods to decrease copper are chelator and D-pelicinnamine, and zinc salt, and antioxidants such as vitamin E. The treatments for chronic hepatitis are number 1, prednisolone, especially when it's idiopathic. Number 2 is UDCA, which is ursodeoxycholic acid. And number 3 are antifibrotic drugs. Prednisolone also falls under this category. And number 4 are antioxidants, such as vitamin E and N-acetylcysteine. For the surgeries, we can do a biopsy and a lobectomy. So the definition of chronic hepatitis, it's basically a group of inflammatory or necrotizing liver disease. Inflammation always with necrosis in the case of chronic hepatitis. We can often see periportal necrosis and fibrosis. The pathophysiology of chronic hepatitis is poorly understood. It can have an immune background, so it can happen after corticosteroids, or it can be caused by copper or alpha-1 antitrypsin. It accumulates in the liver and causes necrosis. So the background of chronic hepatitis, it can be genetics, infection, or drugs. The genetics include Bedlington Terriers, Dalmatians, and Doberman. For infectious, it can be rhubarb disease, canine adenovirus 1, or leptospirosis or Helicobacter. For the drugs, it's all the antiepileptics or anticonvulsive drugs and carprofen. So copper's role in hepatitis. So it can be diffuse or localized. If it's diffuse, you start with chelator, which is D-penicillamine, and if it's localized, you give prednisolone or cyclosporin. So basically the role is copper is stored in encapsulated hepatite lysosomes. Copper accumulates in the lysosomes, but it can get into the intracellular cytoplasm and it destroys hepatocytes, causing oxidative damage and leading to necrosis. Chelator or D-pelicinnamine actively binds free extracellular copper and forms a complex with it, and it's then excreted in the urine. So when treating chronic hepatitis without copper, you give steroids, and when you're treating chronic hepatitis with copper, you give chelator. So in copper chronic hepatitis, it can be primary or secondary. The primary is familial, so copper is progressively elevating throughout the life of the animal, and the liver damage is proportional to the degree of the copper. It's centrolobular. It is autosomal in Bedlington Terriers, and in Doberman, it is extremely common in females. It is immune-mediated, so you treat it with glucocorticoids. In secondary copper chronic hepatitis, the copper increases due to another cause of liver destruction. It is not progressively elevating throughout the life of the animal. The disease is periportal. It's not centrolobular like in primary. It is a secondary problem due to cholestasis, so you should never give chelator in the case of secondary copper chronic hepatitis. Copper storage disease in Bedlington Terriers, which is a primary form of copper chronic hepatitis, is an autosomal recessive inheritance disease. There is progressive copper accumulation throughout the life of the animal, resulting from the failure of normal hepatic biliary excretion of copper. Basically, the animal is not able to get copper from the lysosomes into the biliary tract. The bile copper level is low since it's not being excreted into the bile. The copper accumulates in the lysosomes throughout the life of the animal and it causes liver damage. So in homozygous animals, in young animals we can see elevated ALT, but in older animals we not only see elevated ALT, but we can see weight loss, cachexia, ascites, jaundice and liver cirrhosis. In heterozygous animals, we need to exclude these animals from breeding programs. So the methods for decreasing copper: you can give chelator or depenicillamine in the cases of primary copper chronic hepatitis. It removes copper from the liver and it's excreted by the urine. You give it to the animal on an empty stomach. It causes immunosuppression, and don't give it with zinc. Zinc is the second form of decreasing copper, but you do not give it with chelator. Zinc decreases the intestinal absorption of copper. It is good in the case of cholestasis, which causes secondary copper chronic hepatitis. And the next method is giving antioxidants, which protect against copper-caused oxidative injury of the liver, such as vitamin E and silymarin. So in treating chronic hepatitis, you need to first eliminate the cause. If the cause is idiopathic, you can use prednisolone. Corticosteroids are an efficient first-line defense. You can also give cyclosporin as a first-line defense. You can also give UDCA, ursodeoxycholic acid. It's a hepatoprotective. It works as an anti-inflammatory and it's also cholorectic. It increases the volume of bile secreted by the liver. You do not give it in the case of EHBO. This is the case where the outflow of bile from the liver to the intestines is blocked. So increasing the outflow would worsen the situation. You can also give antifibrotic drugs. You can give penicillamine, but not in the case of cats, and N-acetylcysteine. And you can give antioxidants such as vitamin E, N-acetylcysteine, silymarin, and omega-3. And lobular dissecting hepatitis is an idiopathic chronic hepatitis which is mostly found in young poodles. And non-specific reactive hepatitis is the consequence of extrahepatic diseases. It can be caused by metabolic diseases such as Cushing's, Addison's, and diabetes. For a biopsy, you do not open just for a biopsy, you do it when it's already open. There's always a risk of bleeding and contact metastasis. You can always do a punch biopsy, but a ligature biopsy is safer. And the second surgery is a lobectomy. 70% of the liver can be removed without function loss. The indications are ruptures and tumours. Hepatocarcinomas are slow and solitary, but biliary carcinomas are aggressive and metastatic. You basically do 3 mattress sutures to compress the base of the lobe, and this controls bleeding, and then you leave the base behind.